This segment of DelmarvaLife is sponsored by TidalHealth.
Do me a favor, take a deep breath. Doesn't that feel good? Well, for most of us, it's something we rarely ever think about, the simple, effortless act of filling our lungs with air.
And for thousands of other people, every breath is a battle. It's a reminder of just how fragile that freedom can be, but there is a way to get that freedom back. We are so happy to be here with Dr. Grace Salacup with the TidalHealth Pulmonology and Critical Care. Welcome to Studio D.
Thank you so much for having me. It is a wonderful opportunity.
So you just joined TidalHealth this past year. Introduce yourself to the community and tell us a little bit about your medical background.
So hi everyone. My name is Dr. Grace Salacup. I work as a pulmonary and critical care physician, which means I work both as a lung doctor as an ICU doctor. I did my training in the University of Maryland Medical Center, where we were exposed to different kinds of lung diseases, including asthma, COPD, and even advanced lung diseases, including pulmonary fibrosis, which means scarring of the lungs, advanced COPD, which means COPD patients that wear oxygen, people with pulmonary hypertension, meaning their blood pressure in their lungs are high, or if they have advanced damages in their airways called bronchiectasis. And with this exposure, we were trained to treat and manage these diseases, including medical therapy and advanced lung treatment, including lung transplant.
Okay, all right, and the TidalHealth Lung Transplant Clinic is something new. Can you talk a little bit about what the clinic is and your part in it?
So I'm really excited about this clinic because it's going to be a bridge for our patients with advanced lung disease here in Delmarva Peninsula. So when we optimize all the medical and all the surgical options for our patients and their lungs is not still working the way it's supposed to be, then the option would be a lung transplant. And this clinic tends to see and evaluate patients with advanced lung disease and see if they would be candidate for a lung transplant. And if they have barriers for a lung transplant, including smoking, this doesn't prohibit them from getting lung transplant in the future. So our clinic is willing to work with them to optimize these barriers, to have them an opportunity to get lung transplant, and also to bridge them to lung transplant centers, including University of Maryland, Hopkins, Temple, Inova, and even Duke.
Wow.
And during their post-transplant, we will be able to see them as well, and this will help them to save a couple of trips across the bridge.
Yeah, that's
Wow.
important.
So for folks who maybe have an interest in finding out more about this and a lung transplant, where do they go next? Where do they start?
Well, they could call us in our clinic. So it's 410-543-7722. Or they could have my work email, which is grace.salacup@tidalhealth.org. They could ask their primary care or their pulmonologist to reach out to me, and we will be happy to bring them in our clinic.
Okay, very interesting. Well, first, welcome to Delmarva. Thank you
thank
so
you.
much, Dr. Salacup with TidalHealth, and thank you for coming in this afternoon.
Well, thank you so much as well. Thank you so much.